presentation today is going to be on the 8 common sleep disorders. Our first sleep disorder we are going to talk about is going to be the obstructive sleep apnea. This disorder happens when something partially or completely blocks your upper airway during shut-eye. That makes your diaphragm and chest muscles work harder to open the obstructive airway and pull air into the lungs. Breathing usually resumes with a loud gasp, snort, or body jerk. The condition can also reduce the flow of oxygen to the vital organs and cause irregular heart rhythms. The people who are most likely to get this sleeping disorder are overweight or obese people. If you have a thick or large neck or have smaller airways in your nose, throat, or mouth. It can also happen if you have enlarged tonsils or too much tissue in the back of your throat or a larger than average tongue. The second sleep disorder that we are going to discuss is delayed sleep phase disorder. This is an internal sleep disorder in which your sleep pattern is delayed 2 hours or more from normal sleep patterns, causing you to sleep later and wake up later. The third sleep disorder that we're going to discuss is jet lag. Jet lag symptoms usually occur within a day or two of travel if you have traveled across at least 2 time zones. Symptoms are likely to worse or last longer the more time zones you have crossed, especially if you have traveled in an eastern direction. It usually takes about a day to recover from each time zone cross. The fourth sleep disorder that we will discuss is advanced sleep phase disorder. This is a sleep disorder where you keep going to bed and waking up too early. It might feel like you don't get enough sleep because you are waking up so early. But even if you went to bed 3 hours early, you would get sound sleep, but your body would start waking up early after a few nights of the early to bed pattern. One of the best ways to treat this is with medication called melatonin. It will reset the body clock. The fifth sleep disorder we will discuss is narcolepsy. Narcolepsy is a neurological disorder that affects a person's control of their sleep and wakefulness. It is typically characterized by sudden sleep attacks that can occur during any type of activity at any time of day. With this disorder, a person is at a greater risk of having an auto accident and suffer poor work performance. They also have sleep attacks and suffer from depression from this disorder. The sixth sleep disorder we will discuss is 24-hour sleep-wake syndrome. Non-24-hour sleep-wake syndrome is a chronic steady pattern comprising 1 to 2 hour daily delay in sleep, onset and wake times in individual living society. This syndrome is largely linked to blind individuals. The seventh sleep disorder we will discuss is restless leg syndrome. Restless leg syndrome is a condition marked by unpleasant leg sensations while resting. Restless leg syndrome frequently leads to insomnia. Medications are now available for restless syndrome. And the eighth and final sleep disorder we will discuss is sleepwalking. A person who is sleepwalking may walk around or do complex behaviors while still technical asleep. It may be as simple as sitting up in bed or as complex as leaving the house and going for a drive. It is not clear exactly what causes sleepwalking, but some say that stress, fever, sickness, medication, and psychiatric disorders can trigger sleepwalking. These 8 sleeping disorders are in everyday life and can be treated with several remedies. Some can be treated as easily as losing a few pounds, and some can be treated with medication. Sleep disorders are things that can affect your life in many ways. They can deprive you of sleep, they can make you perform poor at work, or they can make you oversleep. Sleep disorders are very common in our everyday life. Thank you.